Rheumatic heart disease. Rheumatic heart disease is characterized by deforming fibrotic valvular disease. Deforming fibrotic valvular disease. Rheumatic heart disease is characterized by formation of deforming fibrotic valvular disease. Site mitral valve. Mitral valve is the most common site for rheumatic heart disease. Mitral valve is the most common site for rheumatic heart disease, which is characterized by deforming fibrotic valvular disease. Predisposing condition for rheumatic heart disease: recurrent acute rheumatic carditis. Recurrent acute rheumatic carditis. Recurrent acute rheumatic carditis is the predisposing condition. Morphology: ग्रॉस मॉर्फोलॉजी में मैककेलम प्लैक्स. मैककेलम प्लैक्स आर irregular thickening in the left atrium induced by subendocardial uh, cardial lesions. McCallum plaques are irregular thickenings in the left atrium. McCallum plaques are irregular thickenings in the left atrium. McCallum plaques are irregular thickening in the left atrium induced by subendocardial plaques. Induced by subendocardial lesion. McCallum plaques are irregular thickenings in the left atrium induced by subendocardial cardial lesions. Mitral valve. Mitral valve shows leaflet thickening, commissural fusion and shortening, and thickening and fusion of the chordae tendineae. Mitral valve shows leaflet thickening. Mitral valve shows leaflet thickening, commissural fusion and shortening, thickening and fusion of chordae tendineae. Calcification and fibrous bridging across the valvular commissures in mitral stenosis create fish mouth stenosis. Calcification and fibrous bridging across the valvular commissures. Calcification and fibrous bridging along the valvular commissures in mitral stenosis create fish mouth stenosis. Left atrium shows progressive dilation with mural thrombus formation. Left atrium shows progressive dilation with mural thrombus formation. Right ventricular hypertrophy in late stages. Right ventricular hypertrophy in late stages. Microscopy: valve with post-inflammatory neovascularization and transmural fibrosis. Valve with post-inflammatory neovascularization and transmural fibrosis. Clinical presentation: acute rheumatic carditis, pericardial friction rubs, tachycardia and arrhythmia. Clinical presentation of acute rheumatic carditis are pericardial friction rub, tachycardia and arrhythmias. Chronic rheumatic heart disease का clinical presentations are murmurs, cardiac hypertrophy and dilation. Murmur, cardiac hypertrophy and dilation. Heart failures and arrhythmias. Murmur, cardiac hypertrophy and dilation. Heart failure and arrhythmias. Jones criteria: major migratory polyarthritis of the joints. Migratory polyarthritis of the large joints. Pancreatitis, subcutaneous nodules. Erythema marginatum of the skin, and Schindenheim chorea. Erythema marginatum of the skin and Schindenheim chorea. Minor fever, arthralgia, elevated acute phase reactants in the blood. Fever, arthralgia, elevated acute phase reactants in the blood. Diagnosis: evidence of preceding group A streptococcal infection. Evidence of preceding group A streptococcal infection with two major or one major and two minor manifestation. One major with two major or one major and two minor manifestations. investigation pharyngeal cultures and antibodies to the streptococcal enzyme, that is streptolysin O, and DNABs, antibodies to the streptococcal enzyme DNase B and streptolysin O. Complication: thromboembolic complications with infective endocarditis. Thromboembolic complications with infective endocarditis.